Good morning, everybody, and welcome back. It is Tuesday. It is your lunch break live. My name is Ivana. If you are new here, and if you hear my co-host in the background, I think the Amazon man is here. So just ignore those four-legged friends down there. But today we're in for a really special conversation, a really interesting talk today with Dr. Matthew Hanserd. Now, Doctor works at Athens Limestone Hospital in North Alabama, and he has been on the front lines of COVID for, I guess it's been 8-9 months now. It's hard to conceptualize that amount of time, but it's been most of the year here. So Doctor's here today to answer some questions you might have and to talk about his experience fighting this virus and treating people in his hometown. Doctor, I know that this has been a long year for you.
That's to say the least. It's been, I think to some degree, it's been absolutely the hardest year of my life, and at some degree, the most rewarding year of my life. It's a combination of both. But yeah, it's been a long year.
You know, I think that so many of us that are not on the front lines of coronavirus, that are trying to live our normal lives, we think about how hard it is for us. We're working from home. We are having issues while working from home with dogs or babies or things like that. But we sometimes, I think, get so caught up in our own worlds, we forget about you and we forget about our healthcare workers. So tell me what your year has been like in the sense of your workflow. Now, I know that you're the Vice Chief of Medical Staff, and you're also the Director of the hospitalist program at Athens Limestone. So have you been able to go home very much, or have you been really glued to the hospital?
You know, in the first part of the pandemic in March, when we were creating emergency response and trying to figure out how to enhance our ICU so we could take care of very sick patients with COVID and things like that, I was here pretty much nonstop for a few months. And since that time, you know, you probably heard the story. So we prepared for a really large surge. Nope, not that many patients showed up. The ones that showed up were very sick. We treated them well. They went home. But since the summertime, we've been very busy taking care of COVID patients. And after 4th of July, there was a big spike. And we've been able to maintain our scheduling in our group. So I do get time off, which is very helpful. But at the same time, it's pretty all encompassing because there's always new treatments, new modalities, things that I'm on the phone about literally every day. So I don't know that I've had a day off from COVID since March.
And we did have a story about your experiences. One of our reporters, Sarah, wrote it. We're going to link to that story here in the comments. But Doctor, I know that in that story with Sarah, in that interview, you talked about seeing patients come in. And I know that this is your hometown. This is your hometown hospital. And that I believe your mother worked there for a long time. So you have known a lot of people that have come in being sick with coronavirus. How has that felt to be treating friends, even family, coworkers that are sick with something that you've been battling all year?
Yeah, I mean, it's a small town hospital. So you're usually, if I don't know the person I'm admitting, I know them or know an acquaintance of them. I always ask patients when they come to the hospital, what community are you from, which is different than like, I live in Athens, but do I live in Cairo Holler or other places? Because I can usually connect to them because I know people that live in those places and then they feel more comfortable. It has been a little weird. The number of people I've had to take care of that I know. We've had nurses here from the hospital that have been admitted. I mean, people I was sitting next to in March going over meetings about how to respond to this virus were the same people I had in the ICU 2 weeks later. And so it's been complicated in that way. It's maybe a little bit more rewarding, but it certainly leaves a little bit more of an emotional toll.
We have heard so many times that the surge is bad right now. Our COVID numbers are going up. We know that November was the worst month Alabama has had for coronavirus patients since this whole pandemic started. Today's December 1st, and we have weeks and unfortunately probably months left going in this pandemic before we get some vaccinations happening here in Alabama and for regular people that are not frontline workers. Tell me, are you frustrated? Are you seeing a drop in your energy and your team's energy in this year-long battle?
Yeah, I think so. So, I think I was telling you before the interview, there's lots of signs outside of hospitals that say heroes work here, and heroes absolutely work here. But we're not superheroes. So we're at the end of the day, we're humans, and most of us are tired because we've worked for a considerable amount of time on coronavirus. it doesn't mean that we're going to, stop providing care, walk off, do anything else. We're going to be here. We're going to take care of you and your family members. But I think everyone needs to understand that there certainly is a level of tiredness associated with how much we've worked.
And I have to wonder as well, if you are in the emergency room or in your COVID unit treating patients and working your tail off, your whole staff is working your tails off, and you see people come in that have the virus that maybe are admittingly not being careful and haven't been careful, wearing masks, social distancing, et cetera. Does that frustrate you?
Not as much as you would think. I take care of people that a lot of times don't do the things that maybe doctors recommend that they do. So I take care of heart attack victims who eat poorly, smoke cigarettes, do all those sorts of things. I can kind of remove that from my mind. I don't necessarily cast blame on patients who present to the hospital. I just treat everybody as a person with a problem that needs to be fixed.
That's interesting. So your kind of thoughts on treating somebody who hasn't been wearing a mask and who has been going to big parties or et cetera is similar to treating a patient that smokes, et cetera.
Yeah, exactly. And humans I told you this before, humans make bad choices. We try to peer pressure everybody into doing this perfect exact right thing. And I'm going to make those recommendations over and over again. Wear a mask, stay 6 feet apart, don't go to large social gatherings and also get your flu shot, which is a big thing that I've been talking about recently. But not everybody's going to do that. And you have to ask yourself why. And the answer to that's a really complicated answer that I could probably talk about for hours. But the answer is it's not their priority. And so we have to figure out a way to make it people's priority.
Now, I know that we had talked about this a little bit beforehand, but something that I think is really interesting, and you just touched on it a second ago, is that people sometimes don't take advice of experts. They distrust experts, especially some of our national experts we've heard from since this pandemic began. You see a lot of people, especially in rural areas, especially in some of our southern states, that say, that person doesn't know my life. They don't know my town. The virus maybe here is not the same as it is in California or Los Angeles. And I'd love to know your thoughts on those patients, those people who say, oh, I'm not sure that advice applies to me because I don't live in a big city.
I'm going to blow your mind on this one. They're right. So you're in this situation where you're in the world in your bubble. And the recommendations that are coming to you might be recommendations that are being given to the entire United States, or there's certain parts of the country shutting down while other parts are not. And we all argue about which group of people is doing the right thing or the wrong thing. The answer is everybody's trying to do the best they can. And it's real easy to get caught up with what humans are doing. But at the end of the day, there's a pandemic virus that's running through society that's doing what pandemic viruses do. And so that's a little bit of a complicated answer, but I think it's important to listen to what the experts have to say. They spend years and years becoming experts. And it is also, having said that, it's also sometimes important to modify what the recommendations are depending on what the locality is. The virus in New York, the way it affects people in New York, though not different in the way they get sick, the way it spreads is a little bit different. I don't have to worry about it spreading on subways in Alabama, right? And so it is different.
Although I do love the subway system. I would love to get that one down here for my 2 cents of what it's worth. Now, I have to ask you as well, this was something you mentioned in your interview with Sarah in that written report that I'm linking here in the comments. And that was about the fear that you have seen in patients when they come in, especially maybe before they have to be intubated and go on a ventilator.
Yeah,
go ahead.
No, you go ahead. You go ahead and finish that.
I was going to ask you to explain what you have seen in those patients and also ask you, what is your biggest fear at this point in the pandemic?
I said that, and absolutely. When people come, they're scared, and not everybody, there's levels of illness. So you have some people that are coming with a pretty mild pneumonia that I can tell them, you're going to be here 4 or 5 days, you're going to go home. Some people come in with a moderate to severe pneumonia, and I say, you could be here up to 2 weeks. Some people come here with that level of pneumonia and progressing where I'm saying, we may be looking at getting towards the ventilator in a few days if you're really not improving. And when you talk to those people, that level of fear about the critical care portion of COVID care certainly is palpable when you're in the room. And I don't want to over dramatize by saying that I see the fear in their eyes, but you do. I mean, they're afraid of that. And our average COVID patient that ends up on the ventilator has been on the ventilator somewhere a little over 3 weeks. So, I mean, that's a long time to be in ICU, and all of the things that are involved with caring for those patients. It's a lot to take on, both for the patients and for those that are going to be taking care of them.
You are in a small town hospital, and you are in a smaller hospital than some other ones across the state and obviously across the country. Do you have what you need in your hospitals in regards to ventilators, beds, et cetera?
Yes, with the exception of nurses. So there's a nurse shortage in America right now, and it's not just in Athens, Alabama, Huntsville, Alabama, anywhere else. Nurses are tired. A lot of nurses got sick. Some nurses retired. It's a real shortage. I mean, we talk about bringing on extra things, and we have to find nurses to be able to do stuff. And as much as I like being a physician and like to believe I'm a hero or superhero too, I'm not. I have to have a nurse to be able to do my job. And so the drugs are here, the ventilators are here. I still have beds to give, and if we fill up, we'll have more beds. We'll find a way to make that happen. But I have to have good staff to be able to do the job, take care of the patients.
And that is I think that's an understatement. We cannot be thankful enough for our nurses and for you and for all of our medical professionals that are out there. Now, again, though, you are in a small hospital. I know you said you have plenty of ventilators, or you have enough ventilators rather, but what about the staff other than nurses, maybe specialty respiratory staff that knows how to use the ventilators? What is that like?
So, we're a small hospital. We only have 10 ICU beds. Well, I believe at this point we have more ventilators than we have ICU beds. But really, when you look at it, the bigger issue is whether or not you have people that know how to run a ventilator. So do you have enough respiratory therapists? Your respiratory therapists are probably the highest risk people in hospitals right now as far as getting sick from COVID and having to be out. And they're specially trained to be able to do that. And same issue with ICU nurses. I mean, for a nurse to be able to take care of a ventilated patient, it takes a little bit of extra training, and that can be given, but it takes years of experience to do it well. And so, shortages in those people, whether they get ill or whatever else, that's our biggest issue. It's people. It's not equipment. It's not drugs. As far as from the hospital side of taking care of patients, it's absolutely, do we have enough people to do it?
We have a question here from William, and he is asking about that people aspect, and he says, why are you short-staffed? Yeah,
so you have some people that got sick. So we lost people to that. I give you an example of one of our nursing supervisors that we had that was out of the hospital. She was in the ICU for three weeks. We treated her. She survived and went home, but it was 6 months before she came back to work. And so there was a lot of people that have been out and sick. There are a lot of nurses that only work part-time that it's hard to get them to come back. I would love to see all their faces, but it's hard work. It's demanding. It's all the time. And they have lives and families and all these other things as well. And it's a lot to ask of them. And we're taking care of more patients. There's also the risk that's associated. It's hard to say why we're 100% short-staffed, but it's a combination of a ton of factors. And that's the best way I can describe it.
We have a comment here I want to point out from Kevin. He says he's a travel nurse and he took a lot less pay to come home and work in Montgomery because he wanted to be home in Alabama.
Yeah,
he also absolutely. Kevin, thank you for everything. Kevin says, I have nothing but good things to say about Baptist in Montgomery. They are giving exceptional care to their patients. Yeah. Well, Kevin, it sounds like you are too. So thank you for that. We've also got a comment here from Dorothy that's saying, look, call all nurses to come back. Is that an option, doctor?
That would be outside of what I'd be able to do. So, can we ever tell anybody that they 100% have to come back and work? I don't know. It's not a military draft. And so I think a lot of people are. I think a lot of people came out of retirement or took up extra shifts, and the people that are working hard are working really, really hard. But we're just that's part of the situation, and some of it's market forces, right? So different hospital systems might be paying nurses more than others, and people are doing travel nurse. Listen, I don't want to get involved in all that. What I want to say is you have the staff that you have, and you want to try to move in the right direction and take care of patients.
We have a comment here from Angela, but I want to spin that into a question. And she says that it's sad when people only take the virus seriously when it affects them. Have you seen that personally, doctor?
Yeah. I mean, I've had I haven't had that many patients that were, I've had some patients that say they didn't really believe in it. They didn't think much about it until they had it. I've had a lot of other patients and patients' families that actually told me they still didn't really believe it existed. I had one patient family that told me that, and I said, well, your loved one's in the hospital with you. I'm showing you that it exists. People believe what they want to believe. I mean, it's here. It is a virus that to a lot of people from a scientific standpoint doesn't make sense because of the variety of symptoms people get. You have some people that have had it that have no symptoms at all. You have some people that have it and just have a small upper respiratory tract infection with a mild cough. You have some people that develop pneumonia, and they may have to be in the hospital for a few days. And then you have some people that are in the ICU for weeks on end. So the same virus and all of it can infect anybody in the United States, can cause all of that. And that's hard for people to understand or conceptualize. Yeah, go ahead.
I'm fascinated by something that you just said, and I think I've heard the same thing from other doctors as well, and that is I will tell somebody's family that they have coronavirus and they don't believe me.
Yeah.
How do you reply to that comment?
People are going to believe what they want to believe. I'm not going to fight with them about it. I mean, it's just I'll still take, like everything else, I'll still take care of their loved one. You know, it's like I'm supposed to.
Question from Addie, have you gotten coronavirus?
Yes, that's an interesting question. I've been face to face with it for since March, and I did antibody testing on myself last week for the first time, and I was antibody negative. So I have not had coronavirus, even though I've been with these patients the entire time.
Interesting. We have another comment from Yvonne. She's an RN working 5 12-hour shifts and is so tired. Yvonne, thank you for your work.
Yeah,
we couldn't do it without you. I've got a question here from Amy that I think is something that a lot of nurses and healthcare workers would probably be able to answer better than me or any of our other people not in the healthcare field. And she says, my understanding is that nurses are not interchangeable. So if you close post-operation units, you can't just plug those nurses into critical care. Is that true?
Yeah, that's absolutely right. And that kind of works with doctors too, is that we all medicine 40 years ago was a family doc, that rode around in a car and could go see people in their houses. It's not like that now. It's subspecialized to the point. I subspecialize. So I'm internal medicine, but I subspecialize in hospital medicine. So I only do medicine in one location in the hospital. So if you put me in a clinic and ask me to take care of people's diabetes or their hypertension, I'm not going to be the best physician on earth at that, because that's not what I do on a daily basis. I take care of things that might kill a person because they're in the hospital with it. Same for nurses. Like you have nurses that just work in the operating room, nurses that just work after people come out of anesthesia, nurses that just deliver babies. They're just there for delivering babies. Asking those people to come take care of COVID patients, yeah, they can start IVs and give medications, but it's a different world on medical wards than it is on the surgical wards or on the OB wards.
There is also, I've got a comment here from Gina. She's was hospitalized for 14 days from COVID. She had a poor immune system because she was going through chemotherapy, and she is a retired healthcare worker. Gina, thank you for everything that you did for the healthcare system, and we hope that you're feeling better.
Absolutely.
We got a question from Susan. She says, can we talk about the capacity of the hospitals right now? We are awaiting the vaccine for phase 1, but I'm worried about the news that we could start having vulnerable patients denied access to healthcare.
Yeah, we never want that to happen. And that's why I've been a little bit more active. I mean, most physicians don't go on the news or have articles written. They just try to kind of hide away and do their jobs. But I've been a little bit more active in this because of a fear that's kind of deep seated in me that we could overrun our system. And, you've already have certain parts of the country, not Alabama at this point, but other parts of the country where the system gets flooded. When that happens, you're right. People are probably going to get turned away that are borderline, the kind of people we might put in the hospital and watch them for 2 days and make sure they're getting better. Those patients may get home to see if they get better or worse and come back. We don't want to have to do that. If I don't have a bed to put a person in, man, that's a difficult situation. That's a difficult situation to be. I want to pretend that we live in a world of unlimited resources. But medicine in the United States, even though we act like it's unlimited resources, there are limited resources because we only have so many people that can take care of patients, and we only have so many hospital beds that are built. And if it gets beyond that, that becomes an issue for the state and government about how do you triage a situation where you've got too many sick people. And my hope is that there are plans ready for that, because we could end up needing them. I hope we don't. But it's something that these are the sorts of things that keep me up at night.
I'm a little bit weirded out. You said that because that was my question, was does that keep you up at night?
Yeah.
Having to turn away a cancer patient to treat a COVID patient or vice versa?
Yeah. So that already kind of happened in the spring, if you think about it, right? So in the spring, we canceled all of our elective surgeries. So when people hear of elective surgeries, I think a lot of times they think about cataract surgery or stuff that can be put off for 6 months. It's not a big deal. Elective surgeries are also things like fairly major surgeries that can be life altering for patients, whether it's doing spine surgery on them, which we do a lot of those here, whether it's, replacing joints, whether it is removing small precancerous lesions that could be cancer in 6 months. And if you fill a hospital with COVID, the functionality of the hospital decreases. So the functionality to take care of patients with heart disease, which is rampant in Alabama, always has been, the functionality to take care of cancer, the functionality to take care of all these other things, it becomes more difficult to do those things. COVID is what COVID is. It's a pandemic virus, and there will be people that pass away from COVID. That is unfortunate, and I'm really sad about that. But where it's really causing damage to people, when you really think about it, where it's really causing damage to people is the people that have things that we can save them from that are missing that boat because of all the COVID care that's having to be done. I lost your audio.
That is my fault. I muted myself so that my four-legged co-hosts would not chime in here. But I have a question from Jenny. She says, I've been battling COVID going on 3 weeks at home. I'm exhausted. Keeping stats up is a huge problem. Home oxygen and an RRT in the house. What are your suggestions and how long can this last?
I want you to repeat that question.
I will. Here, this is what I'm going to do. I'm going to put it right there for you. Jenny says, I've been battling COVID going on 3 weeks at home. She's exhausted. She talks about things. And I know this is a specific situation, but I think there probably are a lot of people who say, I've got COVID. It's been 3 weeks, 4 weeks, and I still don't feel good. What do I do?
There are a ton of patients out there like that. So she's not the only one. There are lots of people who have COVID symptoms that have been bordering into months and several months. There's this term out there called long haulers. Now, I don't know her particular, and I really can't speak to her situation, but I can say that there are lots of people out there like her. So she can at least know that she's not the only one like that. I don't know if that provides any relief at all, but it is certainly something we're seeing a lot.
And I want to quickly go through, and I'm seeing all these comments from people who are healthcare workers or retired healthcare workers, and we thank you so much for your service. Doctor, we thank you for your service as well. I'm going to let you go in a minute because I know you have much more pressing things to do, but I have one question for you, and that is, are you hopeful? Are you optimistic about what is coming?
Absolutely. From the beginning of this, there's always been a question. So there was, how bad is the initial surge going to be? Then it was, how bad is it going to be after we're open and there's a holiday? So that was our 4th of July spike. than it was how bad is it going to get after we restart schools and football restarts and all these other sorts of things that are important to Alabamians. And I understand that because I love football too. And then the next question is there going to be a spike in the fall? And there is. Okay, so we're in it right now. So every day there's more patients getting admitted to the hospital. And my hope is that we'll all gather together and we'll get through this. Vaccine is coming. And I know a lot of people have their reservations about vaccine, but once vaccine's available to you, if you're high risk, 100% need you to get it. Because especially the people over 65, the people with multiple medical problems, if you get COVID, there's a much higher risk I'm going to have to admit you to the hospital. The vaccine will do you great benefit. Having said that, where's the end of the tunnel? I don't know. I don't know how many more people in the state of Alabama are going to get this. I don't know how many hospital beds we're going to have next week. I mean, I expect coming off of Thanksgiving and Iron Bowl that we're going to put more patients in the hospital. And I don't know if we're going to fill everything next week. You have to realize we do fill most years, but we usually fill sometime in January. So filling in November and being full all the way through cold and flu season would be problematic. It would wear us all very thin. And so do what you can do. Do what you can do to help. Help me help you. Wash your hands, stay 6 feet apart, wear a mask when you're in public. None of those things are going to hurt you, and you might be helping both yourself and society.
And to get your flu shot?
Oh, yeah, and get your flu shot. So this is important. People say, well, why should I get a flu shot? That flu shot, this isn't about flu, this is COVID year. And the answer is that on an average flu year, I probably got 4 or 5 people admitted with influenza. And almost every one of those patients that I admit with influenza hasn't gotten a flu shot. And so the important thing there is taking the flu shot does decrease hospitalization for influenza. Why is that important? Because I don't have hospital beds. If I don't have hospital beds to put you in and you have the flu, same issue. Influenza can be just as deadly as COVID can. I have people die of influenza every year in the United States. And to me, they're going to be no different. When influenza patients is going to come, it's going to be no different. But my hope is if we all do the right things, we're going to have the best flu year ever.
Absolutely. And the downside of the flu shot, you'll have a sore arm maybe for a day, but other than that.
Aches, a sore arm, it's a little bit to give up. If you've ever really had the flu, you would realize that the little bit of body aches are nothing. And the reason that you have body aches is because your body's creating an immune response to what's hopefully going to be the flu virus for that year. There's a lot of guessing in the scientific community when we have to make it, but they do a really good job now. I've already had my flu shot. Once the COVID vaccine is available to me, I told you I checked my antibodies the other day and they were negative. The second that the COVID vaccine is available to me, I'll be taking the COVID vaccine. So I'm gonna practice what I preach on this. I'm not gonna hide away and say I'm not gonna take it.
Well, again, I want to thank all of our healthcare workers like you, doctor, like all of your staff, like everybody in our comments. And I'm thinking about all of you in our comments who have said that you either have coronavirus or have had it, or thinking about you, wishing you a speedy recovery. So, doctor, thanks so much again for your time. I know you've got a busy day, so we appreciate it. And yes, sir. Everybody watching, thank you so much. We'll see you tomorrow.
Bye, guys.